morning, and thank you so much for joining us on this live discussion on Around the Table. As it is the routine every Friday, we bring you informative sessions on health, different health conditions and disorders. Now, by virtue of Mater Misericordia Hospital being one of our partners here at Capuchin TV, we have slated this particular day to tell you more about Mater Misericordia Hospital, and more specifically the radiology department. And with me in studio is one of the staff members from Mater, and I'll give her a few minutes to introduce herself before we move on. Welcome, Doctor.
Hello, viewers. Thank you. My name's Dr. Nguku Sophia. I'm a radiologist. Radiologists are the doctors who work and report in the imaging department. They assist in imaging and also reporting. All that goes on there.
All right.
Yes.
Welcome to our studio. This is your first time to grace our studio, so feel much welcome. Now, my name is Sasha Elizabeth, and let's get started. Now, briefly tell us about Mater Misericordia Hospital.
Mater Misericordia Hospital is a Catholic faith-based hospital under the Sisters of Mercy. Although it's Catholic-centered, we take care of patients from all religions. They are treated equally.
So you do not discriminate on any basis in terms of the kind of services you offer? You are open, or rather, to everyone?
We are open.
Okay.
Yeah.
So tell us, what is the radiology department about? What does it do?
Radiology department is a more appropriate name would be imaging department, because it makes it involves the use of radiation, but also non-radiating imaging technologies to produce images which are then interpreted for the purpose of checking whether the body that has been imaged has any disease or not, and to assist the doctors make a diagnosis and go ahead and do treatment for the patient.
Who are likely to be found in the imaging department, or rather?
At the imaging department, you find a wide range of professionals. These professionals are medically trained in imaging, medical imaging. And they range from sonographers, radiographers, MRI technologists, and radiologists themselves, the doctors like myself.
All right, what about the patients?
The patients are also there, and being a medical imaging facility, nurses will also be there.
What kind of health conditions require radiology services?
It's a very wide range of conditions that will be referred to the imaging department. From pediatrics to neurosurgery, from pediatrics department, neurosurgery, outpatient for common colds or coughs, you want to check the chest, people who have been injured and you want to know whether they have fractures or such, all those people require the services of a radiology department.
Thank you. Now, what kind of services do you give these patients who seek attention from the radiology department?
There is a wide range of imaging modalities, and the doctor will select the modality that suits the examination or whatever he would like to interrogate. For example, if you're coming from antenatal clinic and the obstetrician would like to know the condition of the baby that you're carrying, they'll refer you to for ultrasound, obstetric ultrasound, pregnancy ultrasound. If you have had an injury and you visit the outpatient clinic, you may be referred to the radiology department for an X-ray to find out whether you have a fracture or not. So we have these categories or modalities of imaging, and they range from general radiography. I've already mentioned that general radiography is the one used for the X-rays. They are used for finding out, for example, whether you have a fracture or not. There are also very specialized X-rays or radiographic examinations, like the mammography, which one is likely to come because either they want just a medical examination to find out whether they have cancer of the breast or not, or they will come because they've been found to have a lump in the breast. So they will come for mammography. We prefer to do mammography for older patients from 40 years upwards for two reasons. That the breast texture allows mammography becomes optimum for them. But for those patients who require breast imaging for a checkup and they are younger than 40 years, they come for ultrasonography. So the different imaging modalities are selected according to many factors, which the doctors consider.
So what does ultrasonography entail?
Ultrasonography is the use of sound waves beyond our hearing. Mm-hmm. It's a non-radiating modality, and that is another factor why it is more suited for the young people, because they have growing cells. They're in the reproductive age. So we prefer to screen them for breast issues using ultrasound other than mammography.
Mm-hmm. So many people relate or rather link ultrasound to pregnancy. Can other young women who are not expectant be expected to go through the ultrasonography?
Yes, that's a good question, because people may just think that ultrasound is only for pregnant women. Mm-hmm. But other than obstetric issues are issues related to pregnancy. Mm-hmm. Ultrasonography actually is used from head to toe. Okay. For the young children, you'll find that for their brain, we use ultrasonography. We do ultrasounds that are called cranial ultrasounds. Coming from the head, if you have thyroid issues, the first thing your doctor will send you for will be an ultrasound for the thyroid gland. Going down to the chest, as we have said, ultrasonography is the modality for screening young women for breast issues. They may need mammography, but we begin with ultrasound. Then, as you go down to the abdomen, the tummy, as you may call it, we have the liver, the kidneys. The first modality of examining your kidneys when they have issues, when the doctor suspects there's an issue with your kidneys, he or she will send you for an ultrasound of the kidneys, ultrasound of the liver, gallbladder, pancreas. Then, moving down to the ovaries, gynecological examinations for the young women and even other age groups. We will do ultrasound for the pelvis, that is the uterus, the ovaries for the women, and for the men, the prostate. Mm-hmm. And then ultrasonography, very key in examining your blood vessels. When the doctor suspects you have a clot, a thrombus in medical terms, if he's suspecting you have a clot, he will send you for Doppler ultrasound of your blood vessels in the legs. If you come with a stroke, you may find that a doctor is sending you for ultrasonography of your blood vessels going to the head, at the neck. Mm-hmm. So ultrasonography is very versatile. It has a wide range of issues that it can interrogate.
Thank you so much, Dr. Nguku. Now, OPG is a common medical term used especially in radiology departments. Could you shed more light about the OPG unit?
OPG, in full, for those who understand the medical people, orthopantomography is a dental examination. It's an X-ray machine which takes a radiograph of your whole dental system or formula, yes. And so in our hospital at the Mater Misericordiae, we have a dental unit. And we at the radiology department have OPG to take care of the imaging needs of the dental unit.
You've mentioned fluoroscopy.
Yes, fluoroscopy. I know it's a big term.
It's a very hefty term.
It's a hefty term, and many people are not familiar with the fluoroscopic examinations, but they are frequently requested by our doctors. These are examinations whereby we give you some dye, or in medical terms, contrast. Dye is the layman term for it. We'll either give you something to drink, or we introduce something in your system, either in your blood vessels or in your breast duct system or urine system, and then we take we do radiography. We follow that contrast material. We see it lining up your system, whichever the system, whether it is the urine system or the GIT. For example, if your doctor suspects that you have an ulcer, they will not send you for an ultrasound to check your gullet, your esophagus, and the stomach, and the intestine. So they'll send you for something we call barium swallow, barium meal, and such. If they want to know whether a woman who has delayed in getting pregnant has patent tubes, whether the tubes have a problem, they will send them for HSG, where we will introduce contrast material, which is liquid. It will go into the uterus, travel through the tubes, and we can tell then whether a tube is open or not, and we can tell how the state of the uterine cavity.
So all those are fluoroscopic?
Those are fluoroscopic examinations. Okay. People have frequently met them, but they don't know that terminology.
Thank you so much. Now, we are taking a brief break, and then we'll be right back. Stay with us.
Tuambie majina yako na vile ambavyo unahusika katika utumishi wa Mungu katika jimbo hili la Nairobi.
Kwa majina naitwa Madeline Ogama. Nafanya kazi katika hospitali ya Mater Misericordia Hospital iliyo kule South B, Dunga Road. It is the main hospital and we have 7 medical centers. As the Mater Misericordia Hospital, tunashukuru sana kwa siku ya leo kwa sababu kardinali tumekuwa naye miaka mingi sana, and we ensure that he is of good health all through. As he retires, we'd like to wish him well, and we are assuring him that we'll continue taking care of his health as long as he is with us, and we really appreciate. On top of that,
licha ya kwamba mko Nairobi, sijui kama kuna sehemu zingine ambazo huduma zenu kwa watazamaji wengi ambao katika nchi nzima wangeweza kuwapata wapi pengine kando ya Nairobi?
Mater Misericordia Hospital tunawakaribisha pia katika hospitali zetu ndogo ndogo zilipo Nairobi. Nitaanzia na ya kwanza iliyo mbali kidogo katika Thika. We have a medical center at Thika. We have another medical center at the Westlands, Kenrail Mall. We have a Development House Medical Center that is in Nairobi CBD. We have TRM. Hiyo iko katika Thika Road, it's on first floor. We have a Kenrail next to us here in Westlands. Then we have Shuja. Shuja iko katika Spine Road, pande ya Kayole, Komarok na Donholm. Then we have our youngest one, which is at the Karen Medical Center. The Mater Karen Medical Center is located at the Well, which is in Karen on the first floor. Our main hospital offers specialty services, which is open. We have clinics that run. We have appointments. We book for each specialty on different days. We also specialize in cardiac services for both adults and children. And we also have the Mater Heart Run, which unfortunately we didn't have last year because of the COVID pandemic. But this year, we still wish to raise funds, not maybe physically, but we will advise you. So on behalf of the governing council, the trustees, the management, and the staff of the Mater Hospital, would really want to wish Cardinal the best as he retires gracefully.
Thank you for that. Why would the viewer there wish to visit Mater Hospital and not any other hospital? What special do you offer to the patients that come to you?
I believe we offer our services with compassionate. We have integrity. We offer individualized services and take care of our patients' spiritual needs. We are unique in some way because we also have a pastoral department that also takes spiritual care of all our patients. We have a counseling psychology department where we also give services to the people in need.
And for the viewers watching you from around the country, in Mombasa, Kisumu, and probably any other corner of the country, how can they access your services? Probably they have to come all the way to Nairobi, or what arrangements do you have for such patients?
For the patients who come outside Nairobi, I think we have very, very many patients who come for specialized services. We are able to continue monitoring them and just finding out how they are doing. They come to see us on appointment. And for the other outreach clinics, we are able to do, but now we are tied down because of the corona pandemic. But we are still hoping and believing very soon we'll start going out to the outreach, and more especially concerning the heart matters for school children in line with rheumatic heart disease and prevention and management.
We thank you so much, Madeleine. Wish you the best. God bless you, and keep on doing the service that you are doing for God's people.
Thank you very much. And in case anyone is not well right now, in case of first aid, we have an ambulance at the left-hand corner where I'm pointing for anybody who might need our services for now. Thank you, Father.
Thank you so much. God bless you.
Welcome back. If you are just tuning in to Capuchin TV, this is Around the Table show with me, Asasha Elizabeth, and today we have a very special program enlightening you about one of our partner hospitals, Mater Misericordia Hospital. And with me in studio is Dr. Nguku Sophia, a consultant radiologist at Mater Hospital. Now, in our first session, we just try to understand what Mater Hospital is, and just an in-depth understanding of the radiology department. And now we continue with the discussion. Welcome back to the second session, Doctor.
Thank you, Elizabeth.
Now you've enlightened us more about radiography and fluoroscopy. Now tell us a little bit about CT scan, because it is a process that most patients go through. Could you please tell us what it entails, and how best is it offered at Mater Misericordia Hospital?
Yes, thank you, Elizabeth. Again, at Mater Misericordia Hospital, we have a high-end CT scanner, 128 slice, and it is capable of doing a wide range of examinations. CT scan is one of the frequently requested examination, especially for trauma patients. But that does not say that it doesn't have any other role outside trauma, because it's also used for imaging for other diseases, another wide range of conditions. Now, for trauma, why it is so versatile in imaging a trauma patient is that it is it's available, and it takes a short time, and you can do the examinations from head to toe in quite a short time.
Does that depend on the quality of the equipment, the medical equipment used, or any CT scan equipment is capable of doing that?
That's why I mentioned to begin with that we have a 28 slice CT scanner. That is really, really high quality. It will produce high quality images that allow for good and accurate diagnosis.
Okay. Yeah. More often than not, we come across a virtual colonoscopy. Tell us more about that.
Yes, colonoscopy is just but one of among the many specialized examinations that our 128 slice scanner can do. Before I tell you what colonoscopy is by definition, the other specialized examinations include calcium scoring to check whether the state of the blood vessels that supply the heart, and another examination is a cardiac CT scan. Mm-hmm. That is also a highly specialized examination that our machine is able to carry out. Now, virtual colonoscopy, as I had mentioned earlier, to study the colon or the GIT, previously or normally we can do something we call barium enema using radiography, where we introduce some contrast material into your colon, and then we follow it and see whether there are any diseases within your colon. Mm-hmm. Now, less invasive is virtual colonoscopy, which is done by the use of a scanner of the caliber that we have. Interventional procedures range from simple fine needle aspiration. When doctors have found a patient to have a lesion somewhere, they would like to confirm by a lab test what that lesion is. One thing that they could do is send for fine needle aspiration. It's just a procedure whereby by the use of needle and syringe, some sample is taken the way we take the blood, and then that sample is taken for analysis in the lab. If not fine needle aspiration, we will do biopsies. Those can be done at the laboratory by pathologists sometimes. But we have the advantage of imaging. Some lesions are not something you can feel. We say they are not palpable. You cannot feel them, you cannot see it. It was imaged, it was found, it is deep. It may be a lesion in the liver, it may be a lesion in the breast, but you can't feel it. Mm-hmm. So what people come for, or what patients are referred for to the radiology department, is image-guided procedures, whereby we'll either use ultrasound or CT scan to image and direct our needles to that particular lesion. So image-guided biopsy of the liver, we will scan with ultrasound or with CT scan and then direct our sampling through that imaging so it's so specific and it's more accurate than just trying to guess where that lesion is. So image-guided biopsy, it's done all the time at our department, and when requested, it can be done any day of the week.
Great. Now, what is it that stands out in the radiology department, specifically at Mater Misericordia Hospital?
Mater Misericordia Hospital imaging department is a one-stop shop. You'll find all, as you it's done all the time at our department, and when requested, it can be done any day of the week.
Great. Now, what is it that stands out in the radiology department, specifically at Mater Misericordia Hospital?
Mater Misericordia Hospital imaging department is a one-stop shop. You'll find all, as you have seen, we have the whole range of imaging modalities. We have the infrastructure, the technology for reporting. As we've said, radiologists are there making the reports, and we have the technology to report more accurately and faster. We also have the advantage of being hospital-based imaging facility. In case of critical diagnosis, you have the resident medical officers and consultants nearby to take care of that patient. So that's an advantage. Another major advantage is that we partner closely with the financial providers, most of the financial providers in this country, including NHIF. As you may know, medical imaging or medical services are not always cheap, but these medical financial institutions partner with us to make it easier for the patients. So NHIF will pay a good percentage of all the costs for CT and MRI of the commonly requested CT and MRI. NHIF, if you are a contributor, you'll find that that service is there at our imaging department.
Okay.
Yes.
Tell us about the coordination between the radiology department and other departments like the theater, laboratories. How do you ensure there is a unity in the operation?
Yes, radiology department, it's based at not only at the main radiology, where we have all those modalities, ultrasound, X-ray, CT, and MRI services. We also have that X-ray devolved to the outpatient. We also have in theater, we have a specialized X-ray machine that we use to assist imaging during surgical procedures. For example, during when an orthopedic surgeon is fixing a plate on a fractured bone, you image so that the doctor can place that metal in a very specific and once for all.
Now, Mater Misericordia Hospital has got 7 satellite medical centers. Can a patient access all these imaging services from the satellite clinics?
Thank you, Elizabeth, for that question, because many people are not aware that Mater Misericordia Hospital is devolved to many of our estates, so that it is easier for you to access our services from near you. For example, we have services at Buruburu. We have a health center, Mater Health Center at Buruburu. We have another one at Shujaa Mall in Kayole. We have another one at Thika Town. At TRM, we have another center. Come to Westlands, we have one at Kenrail Building. And then recently, before the recent one, let me mention one in Town Center, Development House Clinic. Yes, and finally, we have the newest, which is at the Well, Karen. And at this juncture, I also encourage all these institutions that surround you here, including yourselves, to make use of the Karen Clinic. Now, services have come nearer you, and I'm happy to mention that all these clinics, all these health facilities have ultrasound services. And in addition, the Buruburu Clinic has X-ray facility. With time, we have an X-ray. We have space for expansion for the other radiology services for the rest of the clinics. So even at Karen, X-ray services will soon be provided as you attend more.
Thank you so much, Dr. Nguku. Now, you have mentioned some of the qualities that make you stand out as Mater Misericordia Hospital, and particularly the radiology department. But the viewer right now could be asking himself or herself, why Mater Radiology Department and not any other health facility that offers the same services, or rather?
At Radiology Department at Mater Hospital, we care more. Wow. And yes, being a faith-based center, we are a center with integrity, and you will not be disappointed.
Great. All right. So now, we have some patients who prefer to be at the main hospital. What can you tell them that would guarantee them? Do you guarantee them the same quality of services in the satellite medical centers?
Definitely, because Mater Misericordia Hospital does not. It employs professionals. So the persons and the personnel you're going to find at the imaging facilities, at the health centers, the satellite centers, are qualified personnel, and they are going to offer you the same quality of service as you would get at the main hospital. We are also happy to inform you that we are connected. We have what we call teleradiology, and all our machines are connected to the main hospital. At this juncture, I would mention that the other cadres, the sonographers, radiographers, MRI technologists, are all under the supervision of the consultant radiologists. And we are interlinked, so we can consult each other at any one time, and the images done at Karen can be seen at the main hospital.
All right.
The
That's
images
great.
done at Buruburu X-ray are reported by the radiologist stationed at the main hospital.
Thank you so much. Now we are about to close the discussion. Time is against us. Please give the viewer your parting shot before we call it a day.
Thank you for listening, and I would like to thank Capuchin TV for partnering with us and the viewer. And I would encourage the viewer, if your doctor gives you a request form for imaging, any imaging modality, feel free to consult at the Matter centers and at the main hospital. You will not get disappointed.
Thank you so much for coming over to tell us more about Matter and the radiology department. And I hope we'll have more time next time to discuss some of the conditions that are treated or rather diagnosed in the radiology department. Karibu sana.
Thank you, Elizabeth.
All right, we have come to the end of our discussion today. As I told you earlier on when we started off the discussion, this is a special one just to inform you more about Mater Misericordia Hospital and focusing on the radiology department. I believe you've gleaned quite a lot that will help you when you're making an informed decision regarding where to seek radiology services from. My name is Sasha Elizabeth, and up to this point, I'd like to thank you for making time for this Around the Table show. And in a special way, I thank our team, our camera person, Christopher Odhiambo, and our visual mixer, Cherbor Samuel, and our sound engineer, Frederick Ocheng. See you next Friday.